Hello, welcome back. The topic today we are going to discuss is about blood vomiting. This is a very common condition in the general practice, and most of the people when they see the blood they get scared. So as always we say, whenever you see a blood, don't get scared, don't panic, you don't have to worry first thing. And we'll discuss about the reasons why, how, what we do about the blood vomiting. Okay, so the blood vomiting, most of the people think it comes from the stomach. No, it's not true. But most of the time it's from the stomach part, but it can even happen because from the upper aerodigestive tract, what we call from the nose, upper nose, sinus, the larynx, all these things areas are called upper aerodigestive tract. So this area, when I have a problem, that goes into the food pipe, the blood goes to the food pipe, goes to the stomach, get irritated, then comes out as a blood vomiting. So blood vomiting need not be from the stomach. So we can divide this into children, adult and very old people. So the causes, the reasons and treatment differs for each individual. The first thing when you go to the doctor, they will always ask whether it's a drop of blood or streaks of blood, or what is the color. It's a bright blood, bright angry looking red color, or it's dark brown or something we call coffee ground color. These things are very important, or it's mixed with food or anything else they will ask. So these things, before going to the doctor, you keep yourself ready to answer all these things. In children, the most commonest cause probably we can say is all because of their birth defect in the blood vessels in the upper aerodigestive tract or in the upper gastrointestinal tract. If a vein or artery, it's abnormal and they can bleed. This is the first you can say. The second, foremost we can say is taking medicines, especially painkillers, NSAID, non-steroidal anti-inflammatory drugs, painkillers. Repeated painkillers, they can cause ulcer or even some erosions, just erosion. They can bring out blood in children. And other reasons are all, even a simple anemia, even it can cause a blood vomiting. But the important reasons for them are all any bleeding disorders or clotting factor disorders we call that, or certain anemias or even blood cancer. These are the main reasons we have to rule out, or any anatomical problem in the upper aerodigestive tract that can also cause blood vomiting in children. And in adult, the most common cause, even a repeated vomiting, a person, he vomits for some reason and repeatedly he vomits, that can cause bleeding, the erosions in the mucosa that can cause bleeding, or ulcer, the bleeding ulcer we call that, another reason, or taking medications like aspirin, NSAIDs, non-steroidal anti-inflammatory drugs. These can cause erosions and they can cause vomiting. And people who are taking alcohol, cirrhosis liver, that's a liver failure leading to varicose bleeding we call that, or even portal hypertension that causes the blood vessels to enlarge and they can bleed. It will be a torrential bleeding. Even sometimes a simple polyp can cause bleeding. Sometimes it could be because of the cancer growth. The cancer, the cancer growth starts bleeding, that collects inside the stomach, then come out. And in the very old people, most of the time the reason being mostly drug induced or cancer. The drugs, again, aspirin and painkillers, or any, for that matter, any medicine taken for years that can irritate the stomach, cause erosions and bleeding. Of course, cancer we have to rule out. The third thing, most of the time, if they are prolonged hospital admission treatment, they cause stress ulcers, they can cause bleeding. So these are the causes. And again we tell you, whenever you see a blood in the vomiting, don't get panic or don't get scared. The first thing we always say is, if possible, take some home remedy. Usually home remedy is only antacid, the liquid, the antacid. When you take it, it forms a coating and maybe the bleeding can stop, or you can take something very cold which can cause blood vessels to constrict and bleeding may stop. But this is only a household primary treatment part. But once you know the bleeding is heavy, the blood loss is very high, then you have to definitely report to the hospital or the doctor. Usually if the streaks of blood comes 1 or 2 times, there is no need to worry. But the same thing, the same streaks of blood comes again and again, then you have to look for what could be the reason. So you have to definitely go to the doctor. And even if suppose you have one time of 5 ml blood or 10 ml, nothing to worry. But if the bleeding comes again and again and the quantity is more, definitely you have to see the doctor. Again, the color of the blood. Suppose the coffee ground color, we call that. When the blood goes to the stomach acid and blood becomes more of a black color and it comes out. It's called coffee ground color. Then again you have to go to the doctor. The doctor, once you go, you will ask so many questions, like he will examine you. The first question will say, what is the quantity, what is the color, when did you have that, mixed with blood, mixed with food or not, they will ask you. And he may ask for he will do a physical examination, he will ask for some questions, and then he will ask for some blood tests, basic blood tests, how much the hemoglobin, or he will check your BP, you will have pulse rate. Suppose your blood loss is very high, your BP will be very low, heart rate will be very high. Because of the anxiety, so the heart rate will be very high. But if the blood loss is very high, the blood loss is huge, then the BP will be very low, the heart rate will be more, and they may feel giddiness, they feel very tired, palpitations, they may have palpitations, all these things, they will check. Then you'll ask for other blood tests and scan, ultrasound, CT scan, or even first, then they will ask for endoscopy. Sometimes they will do an endoscopy as an emergency. So what the endoscopy will show, any bleeding from the mouth to duodenum part, any bleeding it will show. The site, the quantity, is there any reason for the bleeding also we can know. Suppose it's a small erosion or from a small bleeding, then we can cauterize it. Or if it's from the varicose bleeding because of the esophageal varices, because of the liver failure, then we can do a banding. Or sometimes if it's a trickling bleeding ulcer, then we can stop the bleeding by clipping, or so it's a diagnostic as well as a therapeutic, as well as we know what could be the reason also we will know. Once we know the reason, once we take control of the bleeding, and once we improve the quality of your anemia part also, then the proper treatment if needed will be continued. So this is 150%. Then after that, prevention part or the treatment part is very important. According to the if it's an ulcer, PP will be prescribed, or if it is from the liver failure, the treatment is different. They have to take prolonged treatment. If it's a cancer, probably they will require surgeries and chemotherapy and other things. So blood vomiting, you don't have to panic and you cannot neglect it. So if it is a very small quantity, once or twice, maybe probably you can take time. But if it is even if it is small quantity, it comes repeatedly, or the quantity is very high, and you feel giddiness or maybe tiredness, or you feel anemic, all these things, definitely you have to rush to the doctor. He will examine you, he will do some investigations and find out the reason, and he will give the proper treatment. Thank you.